All right, let's speak now to Tshifhiwa Tshivhengwa, who's the CEO of the Tourism Business Council of South Africa, and Wendy, who's the CEO of the Restaurants Association of South Africa. Firstly, there's so much economic pain along with the health issue in terms of COVID-19. Let me start with you, Mr. Tshivhengwa. Just tell us how your industry is doing.
Well, our industry is not doing so well. We have been saying this since the beginning of the lockdown last year. It's been about a year and 5-6 months. We have been trying to survive. The entire value chain is strained. We have retrenched a lot of people, meaning that there's a whole lot more people that are unemployed now and dependent on the state. And we also, have been trying to make sure that the businesses that we have remain afloat so that we can sort of protect the supply side of tourism. And if you look at the employees that are still working, majority of them are still on, half pay or 10%, and they're also dependent on UIF TS program. So it is tough time for the tourism industry. We do hope that we get some relief to ensure that, the tourism recovery, can take another pace and make sure that a lot of people come back to work.
So you're saying you want an extension of TERS. That was the relief program, which would give a percentage of people's salaries if their employers could not do that for them. What is the situation from last time? Firstly, is there any idea of how many tourism businesses have basically sunk? Of those that survived, how useful was the TERS program?
Well, the TS program is useful for the employees, although it's not an ideal situation whereby employees get the sum of money that they used to get, but at least it's something that they can use to put food on the table. In terms of the businesses, there has been very limited assistance from government in terms of making sure that business survives. Yes, in the tourism space, we had initially around 200 million that was distributed to around I think 4,000 companies, and since then the rest has been loans. We cannot be going and taking loans and become more and more indebted. We want to go back to work. We have been doing so safely, and we have protocols in place to make sure that we work. So there is assistance for employees, but let's remember that, UIF is money that comes from employees. It's not necessarily coming from government. It's the contribution of employees. Yeah. So when we talk about employees, getting money from government, that alone has not, become a reality. In essence, we are sitting in a situation whereby there's a very little assistance from the state. There's a whole lot more of loans that are being made, money that's being made available for companies to take up loans. But if we take up loans and we're not certain what's going to happen in the next 2, 3, 4, 6 months, it becomes problematic, because we don't know, we don't have a means of repaying. So we want to operate so that, we can sustain our businesses, we can sustain jobs, we can sustain this economy, and the entire value chain of tourism can become sustainable. So it's more about work than taking up loans. So there has been very little assistance.
All right, so you're hoping for some relief to be announced tonight. Ms. Alberts, it must have been a tough 2 weeks for restaurants.
Absolutely. Our industry is on the brink of collapse. It's a devastating time for us. And the thing that is most concerning for us, the inconsistent decisions that government has really taken over the last fractional time to, again, put us into this degree of lockdown. There's been very little consultation. There's been no communication, regardless of how many doors we knock down, how directly we go to each ministerial division, no matter how many proposals and commitments we request from them. There just is an inability to actually truly understand our business. I keep asking government the same question. How can people on the NCC make decisions on behalf of restaurants if they don't actually understand our business model? They don't understand the framework of how we operate. They don't understand the trauma that's currently been impacted on the amount of livelihoods that's been affected, the jobs that have been lost, the current businesses that have been closed. And we consistently go on with the same communication. We're 15 months into lockdown. And the thing that for me is the most concerning is we keep asking about the evidence. And what we are windscreen with it. There is a facade of false evidence. We cannot get the scientific data that draws out the correlation between the risk factor within restaurants as opposed to retail and supermarkets. There can be no further risk to be able to operate our businesses as they would be operating a retail space. 500 people in a 1,000 square meter supermarket, yet we only allowed 50 people in a full-on ventilated establishment that has got all the protocols, all the regulations, social distancing, outdoor areas, etc. And the sustainability on the debt is really having a massive, massive implosion on our industry. And we cannot take any more accumulated loans, debts. We've called to Minister Patel to suspend the leases, to suspend the bank loans, to put them onto deferment and to give our businesses an opportunity to trade through this time. Government has closed us down without compensation, without consultation. It's unconstitutional. We've remodeled our businesses at every single turn, from takeaways to bottle stores to coffee shops to we're now trying to even do the roadhouse concepts, which we still haven't had any form of decision making on. And you can see all these decisions that we've just been left with has really left us questioning who in the South African government is actually taking care and custodian of the restaurants. Yeah. The minister is compromised with her portfolio. She currently is conflicted with having to take care of a great deal bigger portfolio with the health infrastructure. And there's nobody advocating us in the ability to be able to open our businesses. Well, so if we don't even have a voice at the NCC, how do we get our businesses open?
So I think the area where there is some research relates to alcohol, and that's the problem here. The hospitals say we need the beds, don't let the trauma cases come in, and there was research from at least one hospital showing that only a complete ban worked in terms of that. If the alcohol ban stays, are these other options viable? Because I remember last time when alcohol sales weren't allowed, and they weren't allowed at restaurants, you didn't have a lot of custom anyway. Or is there a viable option where you do the roadhouse, you do sit down without alcohol? Can it at least keep things going?
I think the conversation needs to be separated, one between alcohol and two between our businesses. No other industries had to remodel or change their business infrastructure. So we immediately call in that we return to trade our businesses as what they are, sit-down restaurants where we have breakfast, lunch, and dinner time trade. Our people return to work. We have operating hours. We allow families to come and enjoy their meals. And then we have the discussion surrounding alcohol, which is a whole different discussion. And we're looking for that scientific evidence. One hospital doesn't account for every single other person who walks into our restaurant and does actually consume alcohol responsibly. We are custodians of liquor license. We have paid for the luxury of the liquor licenses. We pay to keep our businesses afloat. We contribute to the GDP. And when President Ramaphosa called to this industry, we were first in line to create jobs and to create employment. And now we're in a position where we're destroying it. It is a formulation of both a combination of the experience that people are looking at. And we can no longer remodel our businesses. If we look at what currently is happening around South Africa, it is not fair on the restaurant industry to be targeted, to be isolated, and for the impact that has been made against our businesses without the consultation and without the evidence and without the scientific evidence and without manipulated data. And we keep calling for this data. So if the data is so readily available to everybody else, why hasn't it been presented to our industry for us to be able to look at solutions that are viable, that we can continue to trade? And the most important factor that I do want to remind everybody is that the public is also calling to reopen restaurants. They feel that the advocacy of how we display the protocols and the regulations allow them to safely enjoy meals within our establishments. And I think we've got to take all these things into cognizance, and we've got to look at how we are going to keep the industry afloat, not by putting us into further debt, not by having inconsistent decisions. How did we open in April when it was the height of our festivities for Easter, and we could safely and responsibly work with the Minister of Tourism and open our restaurants with alcohol, safely bring down the numbers, and allow people to come in and be responsible in our restaurants? And we go from that measure to the drastic decision to become takeouts. It's inconsistent. It makes absolutely no sense for us to have been put in this position. And I can only again say it's through lack of proper consultation, where we have the wrong representation at the NCC, with people who do not understand how many people are being impacted, how many jobs are being lost. There currently is a list of closed restaurants that boast more than 1,000 restaurants, iconic, beautiful restaurants, to the landscape of this country, to the culture of the country, to the ability for people to have had dreams, to have invested. And at this point in time, this industry, whether we are employees or employers, have very little confidence in government, in our economy, in our ability to be able to trade through the difficult times. Our people are exhausted. We are emotionally, physically, financially, and mentally drained. We are at the height of suicides in our industry. We've called to get reprieve, and we certainly are not going to tolerate any further restrictions on our industry.
Yeah. Well, what do you mean by that? I mean, what could you do?
We are hoping that the necessary messages and the writings that we put through to President Ramaphosa's office, as well as the NCC, as well as the various businesses that we have leveraged through to help get reprieve for us, have been the voice of the industry. And if it's not, we're going to call to get the voice heard of the restaurants the next couple of days. But if we do not do something, we're going to land ourselves in a decimated industry. And it is not fair that the only support that we currently get is from the beautiful people in South Africa. And I have to consistently thank them for trying to keep our businesses afloat. It is not the South African public's responsibility to keep the restaurants afloat. Minister Patel needs to draw his pen to paper. He needs to suspend the luxury licenses, SAMRO, SAMPRA, SABC, our liquor licenses, put a halt on the leases, put a halt on the bank loans, help us revive through this difficult time. Let us support government by giving us compensation, get the tours open, allow people back to work, allow businesses to trade, and have complete, cohesive conversations about alcohol and how we can work with governments in the alcohol industry to safely dispense alcohol to patrons.
Mr. Tshivhengwa, of course, alcohol affects hotels and how they run. How do you feel? Is there an understanding of how important tourism is amongst the officials making decisions? There must be, because it's so crucial for South Africa. But I guess in your instance, tourism is affected by flights coming in, what's happening globally, not only here, so even more uncertainty.
Well, the tourism industry is a 400 billion rand industry. And if you look at the amount of money that is spent each year pre-COVID, you're looking at around 273 billion every year. And if you look at, the proportion, 60% is local, 40% or 44% or so, it's international. So you do have a very big industry that has been around for many years, because as a country, we're iconic. We've got the safaris, we've got the mountains, we've got the oceans, we've got the deserts, we've got all these things that everyone wants to see, both domestic and international. Now, when you look at what's going on now, and when you look at the restrictions that we have now, the only thing that we have at the moment that's sort of getting our industry to see some green shoots is the fact that we have domestic leisure travel, of which 60% of that domestic leisure travel comes from Gauteng. And people who live in Gauteng are not allowed to travel outside of Gauteng, effectively meaning that those places around Gauteng are not going to receive any visitors. So they get to slash their forecast. So we have a situation whereby if we continue to have restrictions on interprovincial travel, we're going to have a disaster. The very few airlines that are left flying are going to ground their planes. The very few hotels that are still open, they're going to close their doors. The very few car rental companies that are still out there, they're going to close. As Wendy have said, the entire value chain, from restaurants, we are all interlinked. Alcohol plays a role within the hospitality space. And the way it plays a role is that people like to have their meals in hotels, in restaurants, and everywhere else, and enjoy a glass of whatever they like to have, whether it's wine or whether it's a liqueur or whatever it is that they want. But it plays a role. And people don't want to be restricted. They don't want to be traveling to places whereby they cannot express themselves freely. That is why we've been saying that, people should be able to travel. They should be able to go to hotels. They should be able to go to a restaurant in their hotel or outside and have a meal. It's part of the experience. So alcohol forms part of many things that we sell. And therefore, it's something that if it's not there and people enjoy it, just like if you take sugar off the shelf, people won't go to that place because there's no sugar. So if there's no alcohol, and those that like to enjoy it and have it with their meals and do so responsibly, and also following the protocols that we put in place, it becomes problematic. So for us as an industry, we're looking for those type of reprieve. Leave the alcohol ban. Make sure that people can travel interprovincially. Let's make sure that hotels are allowed to serve food within their restaurant area, and the restaurant should be able to open. Let's go back to some level of activity whereby we can balance both the situation that we have in terms of the rising numbers and the people that are sitting at home without any food in their tables. We've got to think of this industry as an industry that creates jobs. We don't just do this for leisure purposes. It's a job. There's 1.5 million people that are dependent on tourism. There are many people that are not even in tourism, that are security guards, that work in many different places, that are dependent on people moving around for tourism purposes. So we've got to look at it as a job creator. Okay. And we've got to look at our employees as essential like any other employees.
All right, I appreciate your time tonight. And yes, both these industries just crying out because of the impact of lockdown regulations. This is something government has to consider while considering the impact of COVID-19, the health impact. Hospitals are bursting at the seams in Gauteng. That was Tshifhiwa Tshivhengwa, CEO of the Tourism Business Council of South Africa, and the CEO of the Restaurants Association of South Africa, Wendy Alberts.